Hi, I'm Todd Pendergraft with Broken Arrow Family Drug, and I wanted to talk to you a little bit today about probiotics. We have a number of patients who ask us what are probiotics and would they be worthwhile for me to take. And in order to explain that, I've got to step back a little bit and talk a little bit about how our bodies naturally function. Our bodies naturally have all kinds of bacteria inside and outside of our bodies. Good bacteria and bad bacteria. The good bacteria in your system, especially those the bacteria in your digestive tract, work to suppress the bad bacteria or other organisms like yeast cells, those types of things that might cause an infection. And so when you don't have enough good bacteria in your system, the bad bacteria or the yeast cells can flourish. An antibiotic, most folks are familiar with an antibiotic. An antibiotic will kill bacteria in your system. What a lot of folks don't consider is that antibiotics will kill both the bad bacteria that are causing you the infection and the trouble, but they also kill the good bacteria, the bacteria that suppresses the yeast cells and those types of things. So when folks take an antibiotic, it's not uncommon for them to have problems like digestive system problems, diarrhea. Women will can develop vaginal yeast infections. So the reason those things happen is because the antibiotic has killed the good bacteria out of your system as well. A probiotic is simply a product that replaces the good bacteria in your system. And when you replace that good bacteria in your system, your system will get back to normal in a quicker fashion. How you determine the strength of a probiotic is by looking at the product and seeing how many colony forming units or CFUs that the product contains. That's how many good bacteria that the product contains. You will want to take somewhere around 10 billion CFUs a day in order to replace good bacteria that you have lost. A number of folks will ask, how much can I get, say, out of yogurt? Yogurt contains good bacteria or probiotics. Well, a lot of yogurt manufacturers are very close to the vest about how much good bacteria that their product has in it. I found a reference that said that a cup of yogurt has approximately 1 billion CFUs. Well, if you need to take 10 billion CFUs a day, the simple math is that you would have to eat 10 cups of this yogurt a day in this example in order to get an appropriate amount of good bacteria replaced in your system. There are also oral capsules and tablets that are available that have good bacteria as well, have 5 to 10 billion units of CFUs in them. And we carry a number of those products here at our pharmacy. And when you look at those products, there are 3 basic types of bacteria that you'll want to look for in that product. There are Lactobacillus, bifidobacteria, or S. boulardii. Most of the products that are out there will have one of those 3 strains. You'll want to take a look at whether the product that you pick up off the shelf has one of those 3 strains and how many CFUs that it has. Taking these things while you're taking an antibiotic or after you've taken an antibiotic will help get you back to normal more quickly and can sometimes prevent folks from having problems like vaginal yeast infections, upper respiratory infections, diarrhea types of problems as they're taking those antibiotics. I want to give a hat tip to Matt Davidson, who was an intern from the OU College of Pharmacy who worked with me last month on this project and putting this together. Matt has just graduated from the University of Oklahoma College of Pharmacy, and I congratulate him on that, and I thank him for putting all this information together. If you ever have any questions or anything that you would like to know about, or if you'd like to start doing business with us, we would love to take care of you here at Broken Arrow Family Drug. Thanks for watching.